good evening and welcome to 2020 Vision. That's a new show for Vodcast. 2020 Vision is going to grow into our news magazine programme. We'll be trying to apply some 2020 Vision to what's going on in the world, in East London, in Tower Hamlets in particular, and the world as a whole. We're going to try and understand things as they really are, without the spin. So if you have an issue you want to raise in the community, if there's something you think the world should know, email me on info@vodcasts.uk and we'll be in touch. But today we're going to concentrate on the story of the day, or the year, or maybe even the century. Coronavirus, COVID-19. Do ring in with your stories and with your questions. Call us on 020 8 1234507 or comment on our live video which is streaming now on Facebook. So, I'm Jenny Fisher and I'm going to be presenting 2020 Vision, and today we have a very exciting guest, Professor Shafi Ahmed, who is a doctor working here in East London, and he's going to be talking with me about coronavirus and answering any questions that you may have. So welcome, Shafi. We're very pleased to have you, although of course we wish it had been in different circumstances. So first of all, to get to know you a little bit, I understand you're working for the Barts Trust, but going back a bit, what actually drew you into medicine in the first place? What made you decide to become a doctor?
Hi Jenny, hi everyone. Thanks for having me on the show, which is so important as a voice piece for the East End of London. So thanks very much for the hard work you put into this. My background, I'm a cancer surgeon consultant based at the Royal London Hospital. I've been there now for a long time. I think it's about 13 years now as a consultant. So the question of why I kind of chose medicine, I've always had the notion of helping science, helping patients, trying to do greater good, helping mankind kind of thing. The altruistic measures that we have within us to think about what profession we'd like to pursue. And being good at science and maths when I was younger, medicine was one of the natural kind of directions that I took. And thankfully, I think I made the right choice. I'm very happy in the profession. It's a great profession. I can't tell people how amazing it really is. It's such a rewarding profession to be involved in every day. And as you've seen with all this COVID-19, the amount of amazing work we're doing throughout the NHS, not just here, around the world, and the universal appeal that healthcare workers have, and the kind of impact they have on society. So on many levels, it was the right choice.
So it's both a scientific job and also very much a people job, where you can actually help people, your clients you see face to face every day, or normally every day, real mixture of the two. Yeah. So obviously I think the viewers will have guessed by now we're not sadly in the same place. It would have been nice to talk to you face to face, but obviously from now on many programs will have to be in this remote format. So can you remember when you first heard the word coronavirus, when you first realised something was happening in China, and what were your first sort of responses to finding out?
So I guess like most people in the scientific community, we kind of heard about things the latter part of December, but really in January, when the information was coming out of China that there was a problem. And the Chinese healthcare professionals and the government had raised it as a concern and issue to the World Health Organization. That's kind of when we started hearing about this new virus epidemic that was coming through Wuhan in China, affecting a lot of people very quickly, taking precautions. And then from then, of course, it's accelerated. So it's really this middle of January where we're all becoming aware of the problem on TV and media, but also scientific journals were producing reports by the end of January, like Lancet, for example, on the effects and the outcome and the precautions we should be taking urgently as a matter of course. So it really was the mid to latter part of January when the world was taking heed of what was going on.
And how did you respond? Did you think this is the biggie?
Well, it's hard to get an idea of the actual picture. We knew it was going to be a problem. And clearly, if the infection came to the UK, which was inevitable at some stage, it's a question, what would we do about it? How we manage the health service, how we would manage the patients, how we would manage the kind of the social mobility of people. It was going to be a big deal. Pandemics, as they arise, are huge world global problems that require really global solutions in some ways. They require government intervention as well as individuals working at the front line to ensure that we're doing the right thing. So it's fairly evident fairly quickly this was going to be a major problem that was going to affect all of us, that we had to make some serious decisions fairly quickly to stop the infection cascading, and of course to avoid unnecessary deaths.
And is this the first pandemic you've been involved in, that's occurred since you were a doctor?
Yeah, look, every year we see some influenza virus. We see the flu every year giving some problems, of course, particularly when you're working in the healthcare service, where as a surgeon, you're limited by the amount of beds, and if the bed's taken over the winter season, like every year, we struggle to get our elective cancer surgery happening. So every year we see a small problem that manifests itself into a lack of beds. But the last real pandemic was a while ago back. There was the SARS and the MERS back in the early 2000s. That was mainly Southeast Asia. So we heard about it, we saw it on TV, we heard about the Ebola virus, of course, a few years later. So we've heard about the impact that these viruses can have and how the intervention that's been proposed and has been working has had its goal in eradicating Ebola very quickly from West Africa, and similarly the SARS from Southeast Asia. So we're well aware of these problems, and every now we hear epidemiologists talk about the next big one. It's coming, be ready for it. Are we organise as a world, as a society, to create some kind of solution to this pandemic?
Yes, I mean, I felt when I first heard about coronavirus, I thought, well, this is very strange because we've had SARS and MERS before. And why is everyone taking this one so differently? So, and also with Ebola, I mean, that was clearly, and still is, clearly a very serious condition. But there never seemed to be the same suggestion that it would come out of Africa. That it seemed to be more localised. So can you tell us a bit about how corona actually happens? What is it about this little germ that makes it spread and that makes it take such a horrible hold on us?
Of course, it's a new strain. That's the first problem. We don't have any immunity for it. The world's not ready. There's been no exposure, so it's completely new, and therefore everyone's at risk, of course. Most infections that come through over the course of the year, there's been some immunity from some people, so not everyone's affected. This one's new. It's highly virulent, which means it's very infectious. It passes very quickly from person to person, and what we've seen, of course, is not only that, but also the fact that we're a global community. We travel a lot. Accessing parts of the globe is simple with cheap flights. And actually, that's what's disseminated all this problem, because we're such a connected community across the globe, as well as having a very virulent pathogen that infects very quickly. And that's been a problem. Also, of course, it has a silent phase. First 3 or 4 days, you may have no symptoms, of course, and then you become unwell. And some people have very few symptoms, so which were unrecognised, but they then become carriers of the virus and send it to other people. So there's a number of areas, a number of reasons why it's been so virulent, and the reason why so many people have been affected so quickly around the world.
Have we really established that it came from bats being sold in a market? I thought I'd vaguely heard that the province in China where it started had something to do with Chinese developing chemical weapons. At first I thought, oh, this is a chemical weapon or a biological weapon that's escaped, and they're blaming it on the bats. What have the bats done to deserve it? But do you think it is bat related? Is that how it happened?
Most likely. I think there's the conspiracy theories around man-made biological warfare, biochemical weapons. I think we'll put that aside at the moment. I think unlikely, and that's kind of, I think, not the right way to think about it. I think this is caused by probably transmission from animals, mammals, it's a bat or something else, to humans. That's what's caused the problem. That's most likely, and that's the reason. And that's the reason we should be exploring, rather than worrying about these controversial theories that they're in the kind of the press at the moment. But I think it's simple. Kind of animal to male transmission, to man transmission, and then dissemination across the community. That's kind of, I think, where the most scientific community would lead us to.
Well, maybe one day we'll need to look a bit more at the procedures, at the safeguards of these close proximities between these virus-carrying animals and humans, but probably not today. What I wanted to go on to sort of ask you next really is, what is the best advice to give to people today? We've been told to wash our hands. We're all now hiding at home. Should we still be washing our hands even if we're just at home? Social distancing, is it really safe to go out and keep 2 feet away, 2 meters away from people? What is the best advice people can do today to keep themselves and their loved ones safe?
So I think we're getting there in terms of the instructions to the public about how we manage this. I think government's now really coming to the right conversation about what we do. And now we're, of course, in kind of lockdown, which is, I think, the right pathway. So what I suggest people do is adhere to all the recommendations from the government, the National Health Service. And these are quite simple. First of all, of course, you wash your hands regularly for 20 seconds, avoid touching your face as far as possible, and keep clean during the day. Second thing, of course, is social distancing. We should be at least 2 meters away from the next person, unless it's our own family, of course. When we're going out, we should only go out for very necessary reasons, like to go to the doctors, get medical help, or to get essential items like food, for example. There should be no reason to go outside at the moment, because what you're doing is you transmit that infection, it cascades very rapidly. One person getting infected from one person that can carry it to like 400 or 500 people within a few days. So you can see the quick rise in numbers of people affected. Then, of course, if you have symptoms or if someone in the home has an infection, you need to isolate yourself. We think that if you have the infection and the symptoms are a cough or a fever, then you should be isolating for 7 days individually. If you're part of a family, you should be away for 14 days to allow you to incubate the infection. And that's been clear guidelines from the government. And also, I think about work. We know that really is about essential work services. You should be going to work only if it's necessary. If you really can't work from home and you're an essential key worker, that's fine. But we should avoid going out at all costs, avoiding gatherings, avoiding going on the train if we possibly can, and really staying at home. It's not easy. It's a testing period, and it's going to be one that all of us are accountable for, and we're all responsible. I think the onus is on the public, the community, to adhere to the advice. It's there for a reason. Otherwise, the infections take place, you get widespread infections, and you see that hospitals now being overwhelmed. And the reason why I'm saying this, not just because it's to stop you from going out enjoying yourself, is because at the moment the hospitals are going to find it hard to cope with the demand of patients coming through the door. And all that this is trying to do is trying to avoid the overwhelming of the healthcare system, so that we can manage patients when they come through the door by putting provision in place. If it's overwhelmed, that's going to be difficult for everybody who requires healthcare service. So it's just to manage it, what's called flattening the curve, stop the peak going too quickly, managing our expectations and the healthcare service so the result is much more sensibly.
Shafi, you are involved in something I think called telemedicine, which I think is an attempt to try and get the message out to people. And I think you've given us a short video clip that we were hoping to play. I wonder if now would be a good time to play that.
Let me give you a big background of what that is, what I've been doing. So one of my backgrounds, although I'm a surgeon, I'm also into innovation and technology and using new models of communicating with people, for example. So I've been working in virtual reality, augmented reality, or what's called mixed reality, using avatars and using holograms and all this kind of thing for the last 5 years. In fact, it's been my work for the last 5 years about how to be distant, be remote, etc. And for me, the COVID-19 infection has been an inflection point for society. Things will never be the same again after today. Telemedicine, for example, the way we communicate on a mobile platform, on a telephone or a mobile phone screen or on a laptop. If you asked 5 years ago, patients weren't happy with it because it was good, but it wasn't good for everything. But now we're seeing, look, our conversation today is on telemedicine, running conferences, we're running meetings. Patients now accessing doctors through a telephone or through a telemedicine platform. The rise has been exponential, people now using these kind of devices and platforms. So I think that's a turning point. We'll see society changing enormously to create healthcare that's more immediate and more remote. So that's going to be the way forward. So what I'm experimenting with is, how do I connect with people in different ways? Would you be happy with me as a human being, as a digital human, creating myself with digital means, with artificial intelligence, with voice recognition, etc.? Would you be happy with me being an avatar? So what we did just a few weeks ago to show that COVID is difficult, because obviously you can't be face-to-face. You're trying to do remote consultation. I worked with a company called Beam in the US, based out in Atlanta and New York, who created a platform on what's called the Magic Leap device. It's a headset, okay? And what they've done is create a platform where I could put the headset on, or just be on a smartphone, and then they would appear in my room as avatars. We could talk and connect, and then share, say, images or x-rays or whatever, like having a real-time consultation. It could be anywhere in the world. So the video shows three of us connecting in the same space. I was in London at the hospital, the other person was in New York, and the other person was in Atlanta. So 3 time zones, 3 parts of the world, but connecting by just a simple 3G, 4G connection. And it shows the future of kind of a consultation between doctors, between doctor and patient, for example. So we played the video now. You'll see that and how it works.
Hey Harrison, so good to see you. Where are you?
I'm in New York. How about you?
I'm in London. So good to see you. I think we've got Ian here as well, haven't we? Hi Ian.
Hey guys, I'm in downtown Atlanta right now. Thanks for joining me. I forgot my Magic Leap, but I've got my phone handy, so joining you through here.
Thanks for joining us. Anyway, Harrison, how can I help you?
Yeah, you know what? Obviously, coronavirus is top of mind at the moment, and I wanted to find out from you if you could explain a little bit about what type of symptoms to be looking out for, and should I be experiencing it, how to go about managing it.
That's a great question, of course, Harrison. It's obviously on everyone's mind at the moment around the world, with lots of infection that we're seeing. So the first thing to say, it's a bit like flu. The virus itself, just to show you what it looks like. So if you look at this, we can actually walk around. So I'll show you as we walk around together. You'll see that this virus here at the moment is, it's quite infective. It's got this S protein on the surface here, which can penetrate human cell membrane by going through what's called the angiotensin converting enzyme pathway. And these are confirmed cases. So what you see in this graph, Harrison, is essentially countries across here. These are China, Iran, Italy, and South Korea, as well as showing you the infections and confirmed cases are on this side here over the course of time, over days, for example. What you're seeing is in China, parts of China, it's become quite static at the moment in terms of numbers, with no huge increases. But what you're seeing in Iran and Italy, in South Korea, are those huge peaks, which I'll demonstrate to you.
Right there, right?
Absolutely, around there. And you see these huge peaks. What it's showing you is a graphical representation.
So, as you see,
That's fascinating.
Yeah, this is really at the forefront. It's like science fiction, isn't it? It's at the forefront of what could be achieved. But it's just showing that in the future, this is what we'll be doing. We won't be traveling as much. I think the climate might be a bit safer from our perspective, with less airplane rides and less pollution, for example. We think about not traveling as much, doing things remotely, connecting, whether you're using telemedicine platforms or these advanced things we're doing at the moment. The world is going to be a different place. And that's what I'm seeing now. We're seeing conferences being cancelled across the globe. We're seeing people doing virtual conferences, virtual MDT discussions of patients.
Yeah. Virtual broadcasts.
Virtual broadcasts. So the world, as I said before, is never going to be the same ever again. And I think that's the right thing. I think it'll make healthcare more affordable and more accessible, I think, because it will just, I think, democratize the access to healthcare around the world, which we were desperate for.
Well, that's... You're right. That really could stretch out the healthcare to so many more people, and I think it's been strange, hasn't it? Just here in Tower Hamlets, there's been a lot of pressure from GP surgeries, I think, to not go in, not have too many appointments. The next appointment is in 2-3 weeks' time. Quite a lot of bureaucracy in some GP surgeries, and then some attempts to use telephone calls, but in the private sector, not in the heart of the NHS. with sort of these new GP services, and it would be nice to sort of bring them together. And certainly, I know I've dragged into the GP sometimes to, we have received your test results for whatever, and I've gone along, and I've had to get a bus to get there, and all, and only to be told, oh yes, your results fine, and we could have had a telephone call, so that would have been very, very helpful. So, okay, you've just shown us the video of the future. Let's talk a bit about the future that's a bit nearer to us. And I'd like to ask you for your insight into whether the NHS, particularly in East London, is doing enough. Is it ready? We've had the news today of a 4,000 bed hospital being created in a corridor or in a room, a hall in the Excel Centre, which is 1 kilometre long.
Yeah.
4,000 beds spread over 1 kilometre.
Yes.
That's big stuff, isn't it?
It is.
Is that going to be enough?
Look, they've so I think the NHS is doing as much as it possibly can. It's not easy because obviously there's a huge restrictions here. One, we don't know about the patients that are coming in. We've done some modelling, computer modelling, and looking at statistics, and there's certainly going to be a rise fairly soon in the next week or two. And what they're doing is providing provision for the expansion of patients that require ventilators. That's going to be the key for the health service. So they're doing what they think is necessary in terms of expanding. Is it going to be enough? We don't know is the answer. We're not sure how overwhelmed the system will be. But to be fair, they've got the military involved. They've built the hospital in East London, Excel Centre. I'm going there tomorrow morning, and 9 o'clock for my briefing. I'll be working there as an advisor for surgery. So I'll tell you more about that as we go on. But it's going to be a place where patients go for ventilation and then be either recovery or sent back to the main hospitals. So we're trying to provide more provision of services. Well, so of course, the other thing, of course, is about safety. Are we doing enough testing for people? And I know the government today released ideas that we'll be doing 2.5 million tests for the public, which I think is the right thing to do for healthcare professionals. We need to assess the level of infection around the community to figure out what the plan might be in the future, so that we can take precautions accordingly. Also, of course, we need to make sure our staff have enough masks to wear and what's called personal protective equipment. And that's been a huge issue over the last few days about not having enough equipment. What's happened, of course, is now being mobilised to the right hospitals, and the government assures us that we've got enough equipment for the time being that's been shifted out to all the hospitals. We'll need more. We'll need more ventilators. We're going to need more protective clothing, more masks, more professionals and more healthcare workers. We're now asked people to come back to work. 15,000 people have answered the call to come back to work after retiring. These are nurses, healthcare professionals and doctors. We've got medical students being pushed out early after qualifying so they can support the health service, and 5,000 of those will start fairly immediately in the next couple of weeks. So, and the last thing, of course, we've asked for volunteers, and there's 450,000 volunteers who've kind of raised their hand to help us. So I see the whole community coming together. I think there's as much as we possibly can. Is it enough? We don't know. That's the big question. How be affected, how the system will be coping, or they'll be overwhelmed in the next few weeks. But certainly there's a lot of movement, a lot of understanding, a lot of thought happening about what we may need the next 2 to 3 months, where we think that's where the main problems of the infection might lie.
Yeah, okay. But the news today, really, I was going to ask you next, is the government doing enough? And you've mentioned the supplies, which they've said are all sorted now.
Yeah.
But really, the buzzword today has been testing.
Yes.
And we're getting testing kits, and they may work and they may not work. And I see that doctors in Bangladesh have invented a very cheap test, which nobody's mentioned us actually going to try to get. So we've got some testing kits. Why is testing so important? What role does it play in caring for people?
Okay, so one thing is that I think we've been slow at in this country is actually testing at the beginning. It may have been because we didn't have enough kits, and we're rationing the kits that we had for those who were hospitalised. So initially, the government was only allowing people to be in hospital and then tested. So the numbers you see that are shown every evening or every day is just patients in the hospital who've been tested. There's no test for the community, no test for healthcare workers. And I think that was the wrong move. It may have been rationing care. However, now we're saying that we're going to expand that. The reason why testing is important is a number of reasons. If you are infected, first of all, as a person, you will know whether you've got COVID or not. If you haven't got COVID, you can go back and do normal things. Your risk. If you've got infection, you take precaution, isolate yourself for the time that you require. Also, it maps the infection. You can see what's happening in real time. It's about epidemiology. It's about population health. So if you know people have been tested and the community, you can see where the pockets are, where the rise and peaks are, where you need to support the services more and predict where the outcome might be worse, for example. So this is absolutely necessary. The World Health Organization have said only a few days ago, the Director General said 3 words. He said testing, testing, and testing, because that's recommendation of managing the global problem. And this will help us plan our healthcare services wisely. From the healthcare perspective, workers' perspective, we want to know, we want to be clear, we want to be safe. We want to have the right equipment. We also want to know whether we're infected or not, so we can either go home or be treated, go back to work if we're not infected. And that requires a turnaround. We're going to be short of staff fairly quickly as people have illness, as inevitable. So how do you overcome the staff issues that might be ill, taking isolation with their families? How do you replace them? You only do that intelligently, ensure that those that do require to be away from work are, those that can work should work. So I think there are a number of levels where testing is the key in the next few months.
I think there's quite a contrast, isn't there, between, we've all heard the news today that Prince Charles has tested positive. Yes. I don't know if he's gone back to work or if he's just, I know he's holed up in Scotland where apparently he has a second home, or is it a third home? And Camilla's with him and she's not got it, and we don't know if their place up there is big enough for them to be self-isolating from each other. So there's lots to... I'm sure it's big
enough.
Well, I'm sure the tabloids will tell us soon. But of course, for us here in East London, it's very different, isn't it? Yeah. We do have a very large amount of overcrowding in our housing, and some of our families must be finding it very testing already and thinking 3 months, is there really another 3 months to go?
Down for 3 weeks at least, if not longer. And Tower Hamlets has unique problems. We have the problems that really arise from the East End is that we have large families. So there is overcrowding. There's a lot of poverty, of course, and access to isolation is tricky. And of course, a lot of patients are seriously unwell. We have an elderly population as well. And we also have lots of people with comorbidity. So people who are diabetics, for example, we have a huge kind of dialysis unit at the Royal London Hospital, which is one of the biggest in the country. We have Barts, which is the biggest cardiac centre in Europe. So we have heart disease, we have diabetes, we have renal disease, and these are the patients most at risk, of course. So the community around East End, Tower Hamlets, are actually high risk, because we know the people that do badly with the COVID virus, get pneumonia, and ultimately might die of the disease, are actually people that are over the age of 60 or 70. But not only that, they could be younger, but with lots of coexisting illnesses, like we see. So I think we have a huge problem, and I think there's a burden on our population. And the Royal London is trying to cope the best it possibly can, taking these patients on board. So I think we are unique in this space. I think we are going to be one of the most heavily hit it. I'm really glad that they're building the Nightingale Hospital in East End, Excel, take away some of the impact for patients from the Royal London specifically. I think it's essential. And I think it's the right place to have the hospital. And also it's for my doorstep, so I'll go and help out as I possibly can.
And it's not like Excel is going to be doing anything else anywhere soon, so it's nice to see that Docklands facility doing some public good. That's great. But I want to bring in now a thought about local authorities. We've got our own councils across East London, and there's also the Greater London Authority and the London Mayor, and they have responsibility for public health. Yeah. Is there anything that the councils are doing? Are they helping? I think we're all going to get a letter in Tower Hamlets, I think. I don't know if that's going to help very much, but is there anything they are doing? Could they be doing more? What help would you like from local government?
So I think there's a few issues that I think is important. I think the public needs support. Look, we have very poor community here in the East End of London. We support them enough through this troubled times? Are we giving support to the homeless, to the people that are most vulnerable, for example? Are we supporting the people with chronic diseases and helping self-isolate, and also giving education to everybody, passing information? It's about information. It's about empowering our patient community making them the champions of healthcare, supporting them and working together as a group rather than being hierarchical. So I think one of the things we need to do is have that community spirit across the entire borough, saying, look, we're working together on this. We need your help on this, this information that you need. Can you help us with this? So I think that's the way we're going to challenge this, to ensure that people who are isolating, who are in social distancing, aren't, for example, vulnerable even further because of those measures. Look, even if you look at the buses, the trains, and in the last few days, they're still busy in the mornings. Do people really need to go to work? Can we avoid some of that? Can we give that information to people about who the key workers might be, using the transportation in a different way, but also using the resources that we have to best equip our community to cope for 3 weeks at least, if not longer. So I think those are the things I'd like to see the council doing, and also the local community working together. For me, the word is collaboration. How do we collaborate together to overcome this huge problem we're facing that's unprecedented since the Second World War? And this requires a strong emotional connectivity and spirit to get us through. And that's what I'd like to see the local government do here.
Yes, I think personally, I would suggest that one of the things that we could, the councils could provide, is a helpline. At the moment, I think there's a great deal of confusion between don't go out in large gatherings, more than 2 people, or the number of people in your household, but at the same time, go to work if you have to. If you have to is too confusing.
Yes,
certainly, part of our media group, our journalists have been saying, well, can they go to work? Obviously, a number of us can report from home, but we were talking about whether it was sensible for us to go from home into a car, drive round on our own and take photos of East London, on lockdown, and put them up and say, look, we found a market stall open here, this is a nice quiet area, or whatever. And we didn't really know if that was a job we had to go to, although we thought it was fairly safe or not. So I think a helpline, if the councils could sponsor it, where you can ask those questions that make you feel really stupid. Ask the stupid questions helpline, I think.
That's a really good idea. I think one of the key things that's coming across is not having ambiguity in the information. We've seen that from central government. There's been ambiguity for the last few weeks about what we couldn't do. People weren't sure. Now we're saying actually we're having much more resolute solutions and almost rules in place. People are saying, okay, I'm understanding. We're not seeing people go off to local markets or go to Mount Snowdonia or into the beach, for example, en masse because they think it's okay. So we are seeing a change in that. But it is about having clear instructions. And that requires leadership, nothing else. This is about leadership, managing a population, investing the time in them, giving the clear instructions, etc. So that was missing, I think. And now we're seeing that's better. I think local government and local community here, local council, could do a lot better with that, of course.
I just must give a quick plug here for any residents of Tower Hamlets homes who are facing, I don't know about medical problems, but financial problems. The Tower Hamlets Homes Financial Health and Help Centre is still open. It's not physically open, but all its advisors are taking phone calls. So if you do have any financial problems, caused by corona or not, do go on the Tower Hamlets Homes website, check out the Financial Health Centre, Help Centre, and give them a call. Because that can also cause people to feel very down, can't it, if you're struggling with money.
Of course.
So there we are. Okay, well, I think let's now just take a little look at the future, as I think we're moving towards the last part of this programme. Is this going to get worse before it gets better?
That's a really good question. So if you look at the experience in Wuhan in China, you look at Taiwan, if you look at parts of Japan and Singapore and Southeast Asia, who really went on an early lockdown. They locked down the country, issued things like social distancing and isolation very early on, but then made sure those rules were followed. They haven't seen many new cases now. It's taken a few weeks. In China, there are hardly any cases coming through on a day-by-day basis. Similarly with Taiwan, Singapore, etc. What people are worried about, of course, is once this infection is controlled and we limit the amount of complications and ultimately deaths, will there be, as we open it up, will there be a second rebound, a second peak, second infection coming in? We don't know the answer to that question. We're seeing a few more cases now in Singapore, now that they've restricted, taken some restrictions. We're seeing a few more in China. But you know what? We can worry about that later. My view at the moment is that we save lives today, put all the precautions, that's all that we can do as a healthcare service and government, ensure that the least amount of people suffer, then plan as we see that second peak coming in. What's good, of course, as we put all the infrastructure now, it will help us mobilize later if there's a second wave, a second problem. Now, that might be 3 months, it might be 6 months, who knows? The stories are different. Some people say this could go on for a year or longer. Others saying, actually, it may not last that long. We might see the first peak within 3 months. Time will tell. But I just feel that we need to do what we can today to do the best we can for people in the country, to save lives, prevent problems, and then plan accordingly as they arise. That's kind of my view of it, because that's what we're here for.
I think you've put it very well in terms of the priority is to save lives now. I think there was a bit of a feeling early on that the government, the UK government, was maybe looking for this herd immunity strategy of, oh, it's not going to be that serious, let a few people catch it now, we'll put the over 70s away because we don't like them around much anyway, they're in a box, and let the population as a whole get some immunity, and then when it comes back, we won't have such a big problem. And I think you've put a very good contrast with that about saving lives now, although, of course, it's horrifying to think, well, if we end a lockdown in 3 months, maybe we'll have another bout of this all next winter.
But then we'll deal with it. My view is that, yes, it may happen. Let's worry about that as it rises. We've dealt with it at the moment. We've got, as we say, save at the moment. Now, I go back to the story about herd immunity. I agree with you. I think the government got it wrong at the beginning. The narrative around herd immunity, letting 60% of the population get infected, which would equate to 400,000 maybe deaths or problems, was the wrong narrative. Now we're looking at the peak in different ways. We're putting precautions in. I'm glad that we've turned that around. A lot of us were actually quite vocal about how we should be proceeding. Healthcare workers were really unanimous in their verdict that this should change. And the good thing is about the government has listened. They've come around now and putting provisions that are much better than they were 3 or 4 weeks ago. I think we're a bit late now. We missed a few weeks where we could have been much more well organised, but that's kind of where we are. So now we've got to just make sure that the public are looked after and they respond to the rules that we put in place to ensure that we limit the damage as far as possible in terms of patients having bad outcomes. So I think we're in a much better place now, much happier since last Sunday or Monday, where the government was really coming to lockdown. I'm much happier and more reassured that we're doing what we can now to avoid the problem that we were all seeing in the background.
I think if you're watching this live, you've got just a few minutes now to phone in if you've got any questions, which I'm sure Dr. Ahmed, Professor Ahmed Shafi would be very pleased to answer. But I know there are some outages on Facebook right now, so it may be that you're watching this on demand. Do email in info@vodcasts.uk if you have any questions, and we'll continue approaching coronavirus experts and broadcasting reputable medical advice as long as we can. We can come back to this issue again. And indeed, we will at one stage. Yeah, sorry, Shafi.
We've got a few questions coming up on the Facebook page that we could answer.
Could you do that, Shafi? Because I'm not seeing the Facebook page for some reason at this end, so I can't read them out for you.
I've just seen some. Hello, everybody. I've been following you on the Facebook. Sakib, good to see you. Sakib's a local GP who, well, actually is a GP in South London, who actually trained with the medical school some 30 years ago. And he's saying that basically he's self-isolating. His wife had symptoms. He doesn't know whether she's got COVID-19 without testing. Means he can't work 14 days. These are the issues around testing. It's a huge problem. Healthcare workers, I've been campaigning on all social media. Healthcare workers should have testing, because it makes a big difference. Because if they're negative, they can presume work and look after the public and the patients, right? So that's one concern that he's raised. I totally agree with that. But I think now the government is saying that there's 3.5 billion tests available for frontline health workers. So I think that's going to be a key change in the way we manage the healthcare workforce. Andrew Stefanescu talked about Romania. So what do you think the role of medical students should be in this crisis? That's a really important question. So as you know, the medical students in the final year have qualified early, they pushed them through, and they're going to be on the wards fairly immediately in the next few weeks. My own medical school, where I was Associate Dean at Barts, for example, they are pushing the students back in to help support, and there'll be a supportive role. There won't be the front end, it will be supporting the clinicians to work, etc. So they'll be doing lots of things to help and support our program. The fourth and third year students also will come on board to help assist, maybe writing, maybe putting notes in, maybe helping in other ways. So the whole community of doctors and medical students now being promoted very quickly coming in. Mohammed Eid is talking about what do we learn for the future? Is there a role for AI to help shortage of ICU doctors? But AI is not really ready at the moment to help this kind of problem. AI has been great for a number of things. In the future, AI will probably be the most powerful technology at the back end of healthcare doing magic. We'll be using it for diagnostics, for images, CTs, chest x-rays, MRIs, looking at the x-rays immediately with AI interfaces, giving immediate diagnosis, which is important. We'll be using it for ultrasound to look at images, etc., remotely using AI interfaces. We will see it being used for the data, the vast amounts of data will come through, that analyze population health, infection, looking at algorithms, predictive values, etc. So I think AI will be useful for that just now, but also for the future. I think if you think about simple AI, like a chatbot, could be the first point of contact for most people worried about COVID. I know the Italians and other companies have already produced a chatbot where you can ask a question, responds, and tells you the predicting value of whether you've got COVID or not, and giving instructions what to do. This takes away some of the work for primary care physicians and the healthcare service. So I certainly see AI is going to be a huge bonus for us in the future. And the last thing has happened is that in Romania, they say government took early measures, and therefore they're quite not sure what happened with that. But if you take early measures, of course, we know from countries, by early measures, you're going to get probably a quicker response and flatten the curve earlier, so that the resource of that particular country can support the volume of work that's required. And those are the comments that I had from the rest of people watching this show.
Well, thank you very much for dealing with that, Shafi. That was very helpful. Another headline I just wanted to mention was we've heard today, just this afternoon, that City Airport is to close until the end of April. So I'm sure the people of Poplar will be delighted by that. A bit less noise. It's very noisy in that area, and of course we're all very excited to see what happens to the air quality during this time of less transport. So looking way ahead, there may be lots of changes to our lives, the way we live our lives. And just two headlines to read out from the Indian subcontinent. Of course, we see India went into lockdown at midnight. 1.3 billion residents in lockdown. So we all just have to hope and cross our fingers that works for them. And I don't know how you service such a large population in lockdown. And worrying news from Bangladesh, where so far the infection rate has been relatively low, so that the garment industry is now particularly badly hit. Presumably, I mean, it's the starting point of a supply chain, isn't it?
Yes, absolutely, yeah. In fact, Bangladesh and countries like that, because they've got huge populations, all kind of condensed in small areas, overcrowding is a huge problem, as you know. It's going to be really, I think the effects might be really profound for their patients and their public, and I'm not sure they put in the right precautions early enough either, like most countries. For example, Bangladesh, I know for a few weeks ago they were allowing flights to come from Milan, the epicenter of infection, people just walking off and disappearing into the community without any testing at all. So the problem with when you look at rates of infection, those rates really underwhelm the actual numbers, because people aren't being tested, so you don't know the impact. We're only going by numbers of tests, which are a very small number. If you look at the UK, for example, we've done so many tests, etc. Because the wide population hasn't been tested, the actual number of infections could be in hundreds of thousands by now. You never know that. You haven't done the testing. Hence the reason why testing is so important. So I have to see Bangladesh and India having huge problems. Imagine that infection goes into a small area like the textile industry where they're overcrowding, working hard, or in areas in the middle of Dhaka, for example, or in the kind of the suburbs of India where there's huge crowding and poverty, etc. It could overwhelm a whole community very quickly and overwhelm a healthcare system that is just not geared up for that kind of level of impact. So I'm actually worried about Southeast Asia, where they haven't taken the same precautions as, say, South Korea and Japan and China and Singapore because of wealth and managing a public. Here you have a 60 million population in Bangladesh in a small area and 1.3 billion in India. And you can imagine a small percentage of that being affected with a 1% risk of death in the infection could lead to hundreds of millions of people being affected. So it's completely worrying, those kind of countries with big populations.
Yes, and that sort of people being very much at close quarters, partly residentially, living very close together, and then of course also working very close together. There must be many, many enterprises where workers are packed in around sewing machines and the like. And so it's sort of like a double whammy, isn't it, of infection being able to spread. So that's a longer term question perhaps, and perhaps one that's more on the economic side. And we do hope to have a show very shortly looking at the economic consequences of coronavirus. But there's just one last question I wanted to ask you. Is what about the rest of medicine? We know that the hospitals in East London have a very high workload, very high patient caseload anyway. So are people still getting their chemo, their dialysis, their sight tests, their hearing tests? Is all that going on still?
That's a really good question. So let me try to be as accurate as possible for you. So what we're seeing was we've cancelled all elective surgery. Elective surgery means doing hip surgery or knee surgery or doing a simple hernia operation, etc. They've all been cancelled for the time being. So all the surgeons are now concentrating on the emergency workload that comes through the door via COVID. The other question is about cancer is a big deal, oncology. Because obviously patients who have cancer often have chemotherapy. They are immunosuppressed. They are much more risk of having problems with COVID-19 and actually dying of the illness. So what we're seeing now is people making rational choices about cancer care. So for example, chemotherapy may not be offered in at that moment because of the risks of that patient. It's a balance between the risks and the effects of the chemotherapy. Patients may be only offered surgery where we think there's a good chance of cure. If it can wait 2 or 3 months, there's less risk. We may wait 2 or 3 months for that patient. We're not offering at the moment the post-operative chemotherapy. We're offering only what's called neoadjuvant. Before the operation, we can treat them, and that's still been affected. So now what we're doing is making rational choices, looking at the risk versus benefit for each individual patient, trying to make a decision around their care. So those are kind of things that have been affected. Of course, has impact on the rest of the healthcare service and the hospital. All the specialists are affected. Everyone's actually on the front line now thinking, how do we manage these patients going forward? We're clearing out a lot of wards because we need a ventilator space and ventilated patients, because that's the one that's going to be consuming most of the energy in the healthcare system. So it'll change immeasurably. It is already. Outpatients are now being done remotely through telemedicine. We're giving outpatient clinic, and now we're phoning people or doing telemedicine appointments. So even going to hospital isn't the right solution. We're trying to avoid people coming in, wanting face-to-face contact. So many things are changing in our healthcare system. Arts Health is no different to any others, making those choices about this COVID-19.
Goodness, that's a massive change, isn't it? And it's a change which could have an impact for years to come. As you know, if we do get periods of light, we'll then have immense backlogs to deal with.
I think so. I like to try and be positive about this, although it's very difficult. Obviously, there's a huge concern, and we know what the problem is. But I think going forward, we will learn a lot from this, about this pandemic. We'll learn more about society. We'll learn more about how managing global health issues will hopefully make healthcare more accessible, like telemedicine and other platforms. Technology will drive some of the change. We'll implement things differently. So I think there are potential benefits long term, which I think are worth thinking about. But obviously, our main concern now is the here and the immediacy. saving lives, saving patients, looking after the best that we possibly can, and really working with the community to ensure that we keep them as safe as possible. We're trying to do what we can. I'm really overwhelmed by the magnitude of volunteers that we're getting, the amount of people supporting the healthcare service, and really it's quite an amazing experience to be at the front line now, where we get so much support from the public, etc. And all my colleagues who work in the front line provides a risk are doing an amazing job in the most difficult and testing times. So it's obviously difficult for all of us watching this happen in front of us. I'd like to think that we are, as a community, becoming stronger as a result of it.
Shafi, it's been a revelation speaking to you. It's been wonderful to hear everything that you've been able to share with us and to advise in a real frontline report. Thank you so much for giving us 45 minutes of your time at this very, very difficult juncture. For the rest of the viewers, whether you are live or watching us on demand, as I said, we are very likely to return to this topic, I'm sure. We're hoping to look at the economic consequences of the virus very soon. But we are also here to investigate any community issues that you have as well. So do email us, info@vodcast.uk, if you have anything that you'd like to share. And hopefully, as we progress through and develop this 2020 Vision programme, we'll be able to have shorter snippets, more people contributing. But I think this was a very fitting way to begin. So can I thank you, Shafi, Professor Ahmed, for your contribution. And can I please sign off if somebody in the back room could press the button?